Right, hello everyone. I think it's working. We shall see. I'm just going to check on my phone as other people seem to be doing, just to make sure. Cool. Um, I will get started. I am aware that this is not possibly the most friendly time to be doing the presentation for people who have regular 9 to 5 jobs. So I know quite a lot of people are, well, I say a lot of people. I know a couple of people who'll be watching it back. So hello to them. Hello to the people who are watching now as well. I'm going to be talking today about therapy dogs, which is a topic very close to my heart because not only do I own a therapy dog, my full-time role is as a PhD student, and I research into therapy dogs and how they might possibly work. So owning my therapy dog, Tallulah, and you'll be hearing lots about Tallulah in this presentation, has opened lots of doors for me, as you shall hear. So for those of you that may or may not know what a therapy dog is, a therapy dog is kind of a colloquial term that we use for dogs that visit establishments, often educational or healthcare, so schools and hospitals. The term can be used to describe dogs that are used for a very particular purpose, such as dogs that are used to facilitate like psychodynamic therapy and used in very, very structured ways. Or they can, the term can encompass like school dogs that are owned by a member of staff and spend their day at school. So although their organisations do have very strict terms for what a therapy dog is, that's kind of the general understanding of what they do. But obviously there's kind of very varied roles and definitions that the terms encompasses, means that there's lots of implications that comes with it not being very well defined. So, for example, government policy, when there is such a wide range of uses and applications that they are used for in these settings, you can't very easily make general policy for it. It also means for practitioners, so either for therapy dog handlers or the settings that they're visiting, they might have very different expectations of what the dog might be asked to do in these settings. So it's kind of a little bit of negotiation that needs to happen. So although they can be used in loads of different settings, such as you see them quite often in nursing homes, elderly care settings, prisons, you'll be able to see them in. I focus on therapy dogs that are used with children, so mainly in schools and hospitals. There are lots of benefits that are associated with therapy dogs in animal-assisted interactions. A quick search of the literature online and you will find hundreds, possibly thousands of items of research that say how wonderful therapy dogs are. So there are improvements to mood, motivation, physical benefits are associated with spending time with a therapy dog. And these are kind of extensions of the benefits that we get from having dogs as pets. It's thought to work in quite a similar way. So I told you I was going to tell you about Tallulah, my therapy dog. So when I finished my bachelor's degree, pretty much the very next day after finishing, I brought Tallulah home. And Tallulah she's now 5 years old, and she's like a tiny little jackapoo. very, very little, scruffy. She's the one in the pictures on my banner. And I knew that I wanted her to be a therapy dog. And this was because during my bachelor's degree, I studied psychology, and I was really interested in kind of the education side of things. My mum's a SENCO, a special needs coordinator in a local school, and so when I finished my bachelor's degree, we kind of cooked up a plan together. So I then became learning support assistant in a local secondary school, and I studied for a master's alongside doing that. And the culmination of my master's was a research project that looked into therapy dogs. And it was all quite serendipitous how it all came together, with my supervisor who wanted to do a project into therapy dogs and animal-assisted interactions. So one of the first slight difficulties, vagaries I kind of found was no, and this is just going purely on my experience and from having done a bit of looking around at when I was getting started about how to get involved. So the first thing I found was there was no standardised training for therapy dogs. Although since then I found that there are some trainers that offer specialised training courses, which is really interesting. And I need to get into contact with them. It'd be interesting to see what they do. So I started by doing standard puppy training. I did that with Louise Williamson at Puppy School, Chichester. And this kind of involved your kind of basic and slightly more advanced puppy manners, positions, loose lead walking, coming when called, and a lot of habituation to new experiences. So such as like different surfaces, investigating new equipment. It also opened my eyes to reward-based training, because Tulu is my first dog, and I didn't really fully appreciate what could be achieved through positive rewards methods, which is lovely. Another thing that was really important for, and these are kind of skills that I feel are particularly important for therapy dogs, is the socialisation, so meeting new people. After I finished that, we started doing some dog aid classes, as one of the other clients was working that qualification with her dog. And this was a load more complex skills. And these are skills that I use when I do visits with Tallulah. So stuff like taking off a glove. Tallulah can help with that. Or she's really good at picking stuff up and bringing them back. So these are really cool skills that we learned that I use on visits. If Tallulah is not feeling particularly confident about being touched by the children that day, if she's not enjoying it, we can do other activities that aren't quite so in her personal space. And she seems to enjoy working for that reward, doing those kind of skills. So this is kind of my first tip. If ever anyone asks me how to get their dog to be a therapy dog, is very early on, we went on to the charity, the organisation that we are still registered with, and we downloaded their assessment guidelines. And we made sure that Tallulah was going to excel at all of them. So there were tasks on there, such as a relaxed settle for a couple of minutes whilst you're talking to a person. Kind of basic positions were asked for: loose lead walking, taking a treat nicely. And one of the things on there, which I was quite surprised about and prepared for, was that this particular organisation don't like their dogs to give paw too often, because if you're working with elderly clients, there's a risk that they could damage their skin by giving paw too much. So I didn't teach Tallulah paw until after she'd qualified. Likewise, for my second dog, I have only just taught her paw because it's clear that she's not going to be a therapy dog. So yeah, stuff like that I feel is good to bear in mind. The organisation that I'm talking about is Pets as Therapy. All these views I'm talking about are my own and not reflective of them. So this is what I found from my research and kind of my preparation. So there are some behaviours and training that we might want to kind of begin working on, training and conditioning. So there's some stuff that we humans do that isn't particularly comfortable for dogs. So sustained eye contact, hugging, being very handsy. Dogs don't typically do that to each other. They don't have hands. So we can start kind of beginning with the training and conditioning to those kind of things. Although obviously if our dog's not responding positively, then we would not work on them. Then we'd kind of work on management instead, so that they don't get put in a position where they're having to be hugged all the time. And also I feel it's really important to be proactive in what we're teaching. So for example, I think not jumping up is one of the important skills for a therapy dog. So Tallulah will do paws up, so I get her she can put her paws on either side of a bed if there's like a protective covering on it, or onto the side of a wheelchair, and that means that the client can stroke her. But obviously we don't want a dog going charging over, batting the person. So we did a lot of kind of, people only say hello to you if you've got all four paws on the ground, treats to their feet, that kind of thing. This also helps because if you are taking your dog into a location where people might not have a load of experience with interacting with dogs, their default reaction might be, no, get up, no. And that doesn't give the dog any information. And it might just arouse the dog even more. So it's better that we're proactive in trying to teach them how we want them to behave rather than reacting. So I took the assessment with Tallulah at 9 months old, and it involved me driving to sit outside a Waitrose where I met the assessor, and it's a kind of holistic temperament test, and then there's a couple of specific things they're looking for, which I have already mentioned. The interesting thing is that currently there are no standardised tests for being a therapy dog in the UK, although there are things kind of in the works from presentations and conferences I've seen about trying to get a standardised test. So Tallulah did the test for the organisation that we're involved with. Some school dogs or other pets that visit locations might not even have had a temperament assessment, so that's something also to consider. I see on the forums and news boards of the organisation I work with is people asking, they're saying, I've got this 9-week-old puppy and I want it to be a therapy dog. Is it going to be a good therapy dog? And the answer is you just don't know. So whilst you can do things like find a reputable breeder, when you can do visits, check they're doing lots of lovely socialisation, habituation things with them, some breeds might be more suited to it than others. But there's not much you can do until their personality starts to emerge and you see what kind of things they enjoy and how they react to novel stimuli. And even then, so Tallulah did her tests at 9 months old. Some bits of literature say that they shouldn't be taking their tests until two years old. which is possibly when dogs reach their social maturity. So there's a lot of things to consider with that when you're going to take your test. Also, when you're deciding whether your dog's going to be a therapy dog, you need to think about kind of the physical demands of the job, skills and quality of the dog, behaviour, obedience, things that you might look out for which might preclude your dog from being a therapy dog. Might be it being overly fearful or getting easily aroused, easily distracted, overexcited. But then, that being said, whilst kind of extremes of that, you wouldn't want to put your dogs through it because it is very demanding on them. There might be, in some, like if they are a bit worried about some things, like if they don't really like their head being tapped, for example, the kind of tasks and work you could do with them might be more, for example, taking the dog out for a walk, that kind of thing, around the facility. So there's kind of slight workarounds, but obviously if the dog's not suited, it's definitely not worth putting them through it. That would be really unpleasant. So research has indicated that some kind of activities might be more stressful for the dog. So, for example, the high contact activities, so lots of stroking, hugging, that kind of thing, have been suggested as being more stressful for the dog than low contact activities, so taking the dog for a walk. And this makes sense based on what we know about kind of how dogs interact, how they like to interact. So Daniel Mills has come up with suggestions about the kind of qualities we might look for in a therapy dog, such as the robust temperament, resilience, adaptability, adequate training, secure attachment to the handler. And this is really important because the handler will act as kind of a secure base for the dog. I'll come back to that later. Self-motivation for the job, which is interesting. So a lot of people with therapy dogs say that their dog really enjoys visits, and even pet dog owners will say, yes, my dog really loves meeting new people, which that's very desirable for a therapy dog. We also, Daniel Mills also suggests that you really want a dog that shows a variety of stress signals. And although that kind of seems counterintuitive, it's, when we think a bit deep about it, it means that the dog can communicate with us when they're feeling uncomfortable, so we can take corrective action to try and mitigate or reduce that stress. We also don't want a dog that has to mask its stress signals and communication, because as I'm sure many people have heard, that the most dangerous kind of dog is the dog that doesn't give those precursor warnings and just goes straight for a bite. So whilst these are really good things to look for, there are some dogs where you just, they just won't be therapy dogs. At the end of the day, my second dog, Peach, she's a rescue, and she was rescued we got her from our foster home at about 10 weeks old, I think. And I was hoping that she'd be a therapy dog. She'd be a lovely another comparison for my studies. But there is not a chance that she is going to be a therapy dog. She's got very high state anxiety level, and she's worried about new people, and she has to approach them on her own terms. She doesn't particularly like men very much. So that's fine, but she's not going to do it. So going back to Tallulah, the star therapy dog, where Peach is lacking, we started visiting at a local hospital, and we started visiting once a week, alternating between a children's wards and an elderly care ward. And quite early on, we realised that Tallulah was better suited for the children. So she's really good because of her size. The children aren't as worried about her as they might be with a slightly larger breed. Not saying there's anything wrong with larger breeds. Some of the best therapy dogs I've ever heard of are larger, but the children seem to enjoy her small size. All her different tricks and tasks, they enjoy doing training and kind of obedience type stuff with her. But so if you are thinking about doing therapy work with your dog, think about the kind of qualities of your dog and what kind of visits might suit the dog as well as suits you. So it's really important to consider what will suit the dog, because often the emphasis is on the humans. So in the literature, we talk a lot about the positive benefits for the human client. But another human to consider is the handler. So there is a lot of motivation for someone to be a therapy dog handler. It's seen as a really nice thing to do. But this doesn't necessarily mean that the dog's enjoying it. And a more neutral observer might pick up on things going on in a therapy dog visit that the handler can't see because they're too involved in what's going on and the positive reinforcement that they're getting from their dog helping a child or adult. In fact, handlers have been demonstrated in the literature to describe their dogs on visits as feeling happy, satisfied, in a really good mood, enjoying it, which really kind of smacks of anthropomorphism. So this means that we need to have a really good knowledge of dogs' body language and communication, and be willing to read it as during the visits and after the visits. So Rise Van Fleet suggests that dogs shouldn't just shouldn't just tolerate the therapy dog session. They should actually enjoy it and consent to it. So signs of this might be that they are looking relaxed, happy, that they freely approach the task or the client. So one sign of this might be when you're getting ready to leave the house, ready for a therapy dog visit, and the vest comes out, you get your lanyard, you put your t-shirt on, the dog's putting in its special collar and lead. Is the dog looking happy and excited to go out, or are they looking reluctant? This might kind of indicate how they're feeling a little bit about it. Another interesting point about consent is that some organisations require the dog to be on lead at all times when they're on a therapy dog visit. And whilst this makes a lot of sense from the health and safety point of view, this also limits the dog's opportunities for choice making. It means they can't move away necessarily very easily. So you kind of have to balance up how we're using our equipment as well. So whether they're on a tight lead or whether they have a bit of opportunity to move away if they want to. We have to remember that a visit's very tiring for the dog as well, because they're constantly inhibiting their behaviour and making the right choice, the choices that they think they want us to do. So you might notice on the way home from a therapy dog visit that the dog's just spark her on the back seat, just absolutely fast asleep. I was listening to a presentation about equine assisted therapy, And the presenter said that very often the horses will be fast asleep straight after the session as well, because it takes so much out of the animal. If the dog is consenting to the interaction and they're enjoying it, we also have to that also might make us imagine that the quality of the therapy is going to be better, because it's kind of those positive moods, good vibes are likely to transmit to the client as well. We don't want a dog that's hating it telling us that with every inch of their body, and the client picking up on that. That's not going to be a very nurturing and constructive atmosphere. Interestingly, though, I've said a lot about the kind of the stress signals and the importance of reading the body language. There's quite a lot of evidence in the literature that suggests that therapy dogs don't exhibit many stress signals during visits, and they've kind of reinforced this with measurements of salivary cortisol as well. So this would suggest that they're not very stressful experiences for the dog, which is like brilliant. But that might not be the case for all dogs. And we need to think as well about, this is one particular study by Glenk and colleagues, 2014, and they had a really lovely procedure of doing loads of preliminary visits with the dogs, getting them used to the setting, the clients they might be working with, all those kind of things. So that is likely to make the dog feel less stressed about the visit as well. And working with the same clients, kind of it's more predictable, all those kind of things that we know a dog will enjoy. We also need to consider as well that the dogs in that study might have been very experienced. I can't remember if they were used to visiting those particular establishments where they were tested in, but that might also contribute to how the dog is feeling about the therapy dog sessions. There is kind of conflicting evidence. So I said lots of the literature doesn't find any stress signals. A really interesting study I found was by, very good point, made by, is that Miami? I'll come on to that in a second. Very, very important. It found that even though they observed some therapy dogs during sessions, and although they didn't find any behavioural indicators of stress, quite a lot of the handlers reported their dogs as feeling stressed. So it's interesting that even in the absence of those external indicators, the therapy dog handlers somehow intuitively feeling that their dog's stressed. So because of this potential for stress and negative outcomes for the therapy dogs, it might mean that we need to set rules. And I am captain of no fun with all my rules in many aspects of life. So for example, we might set rules about number of people that are allowed to interact with the therapy dog at one time, where we can touch the dog. One thing that I'm particularly an advocate of is giving the dog a safe space in the establishment. So especially a school dog that's there all day, giving them a crate that they have free access to, or a bed they have free access to, and that the rule is that when they're in their crate or in their bed, no one's allowed to interact with the dog. Just because it can be so full on with them and so draining that we need to give them the opportunity to have downtime. Obviously, if you're doing a visit for like an hour, that's not likely to be a consideration that's that important. But yeah. We also need to make sure that they have basic care, so stuff like access to drinking water, that kind of thing. There are ways that we can communicate our rules that make them less confrontational. So I don't really, because Talia's so little, she particularly finds being reached over her head very aversive. And obviously, well, many dogs do. And obviously, it's a bit dangerous. You don't want your dog being poked in the eye or having ears pulled, that kind of thing. So I often say, oh, Tula really likes being tickled on her chest, or can you feel how soft the fur is on her back? So there's different ways of phrasing it rather than being like, don't touch her on her head. We can use little workarounds. And if an interaction isn't going the way we like it, I have kind of some stock phrases that I might go to. Oh, did you see Tula yawn then? She must be very tired. I think it's almost time for her to go home. And then I get them to say a goodbye and then we leave. Or, you spent lots of lovely time with Tallulah now, so we need to let other boys and girls say hello to her. And then I make a bit of an exit. So, as I said, it's really good to have rules in place, but it's kind of how we communicate them can. Some rules I definitely feel can be, when she's in a crate in school, no one's allowed to go in and touch her. That's fine. But other times we might want to be a little bit more soft and fluffy with them. Remember, the reason why we have these kind of rules and guidelines that we set ourselves is because we are the ones looking out for our therapy dog. They can't advocate for themselves. So we need to be very sure about what we're going to allow, what we're not going to allow. And if we use our kind of get out of jail free card excuses, no one's feelings are going to be hurt, and it means that our dog's welfare is protected. So it's kind of a win-win. Interestingly, in a conference I attended over the summer, there was a presentation I was really keen to see about adverse events that occur during therapy dog sessions. And they found that very, very few negative events were happening. Sorry, I should rephrase that. Very, very few negative events were being reported. The researchers suggested that this was likely because of an underreporting. Sorry, going back to Alice. So Alison said, schools are very stressful environments for dogs. Dogs expect to work for longer than necessary. No safe space. But the crate's very important, but depends where it is. It's in a busy office with lots of traffic. It's still stressful for the dog. Very, very good point. So obviously my suggestions are not put them in the crate, let them go in the crate where it's still going to be stressful. We need to try and engineer the dog's environment so that they can have the most the kind of the environment that's going to set them up to feel as secure and safe as possible. So if it means, when I was working in a school and taking Tallulah in, there was a medical room that was predominantly used for if students were diabetic, they'd go and inject themselves with insulin, or if they needed, it wasn't like the school nurse's office, it was just kind of for very low key, that kind of procedure type thing. So we set up Tallulah's safe space in there because it was, and it was kind of, so very few people would access it, and her crate was in there, and kind of there was a bookshelf that kind of split it as well. So yeah, it's not an ideal situation, but it's kind of the better of bad situation in a way. Yeah, it's kind of a bit of a workaround. It's still not ideal. But I think you'd be surprised at how many schools that don't even have that for their dog, where the dog's kind of just around wherever it is. So it'll be a slight improvement. So as well as us being our advocates for our dog and looking out for their welfare, another really important consideration when using therapy dogs is we don't really know how they work. So obviously, hanging out with a dog is a really lovely experience, but kind of what makes it lovely? Is it, when I worked in school, was it just because they didn't have to go to double maths? Was it because it meant that they got to go and spend time with teaching assistants, LSAs, and then they could kind of vent about their day in a with the neutral stimulus of the dog there? So there's lots of different things to consider about how, like the mechanisms behind how therapy dogs work. So that's kind of where my research comes in. I'm trying to find out what could be behind the effectiveness of therapy dogs. So there are loads and loads of different theories about how they could work. My first study was is in the school that I worked at, and a nurture group of low ability secondary school students read to either Tallulah or to me. And we found that the children read more fluently and confidently, their body language was more positive, and they reported feeling more confident and more willing to read to Tallulah than to myself, which is fine. I didn't take offence at that. But then we thought into it a bit more, and we thought that comparing a therapy dog to just a human isn't a fair comparison. It's missing on all the kind of novelty of a therapy dog. So we got this, and this is a Miro robot developed by Consequential Robotics and Bristol University, and it is a robotic animal designed for use of children that is designed to behave like an animal. So the control system is based on a mammalian brain, touch sensors all over its body. It enjoys being stroked, and it will wag its tail. It will change its frequency of vocalizations, pitch, depending on whether you're making it feel happy by stroking it, or whether you're making it angry by bopping it on the nose. It also has cameras in its eyes, and it looks for people and will move towards them and orientate itself towards them. So we thought that was a better comparison for a therapy dog than just a human. And what we found was that children still preferred the therapy dog, and that was on a vast majority. I think only 2 students out of the 30 preferred the Miro robot. With that being said, they still rated the robot as being very enjoyable, and they spent longer interacting with the robots, which was interesting. So even though we can use loads of science to develop a fake animal, it seems that there's something really special about therapy dogs that we can't quite emulate yet. So that study we did in a very, very controlled laboratory setting. Then we took our experiment out to Winchester Science Centre, and we compared a number of different therapy dogs. We had a Samoyed, we had little Tallulah, and we had a flat-coated retriever. And we found the same thing. The children massively preferred the therapy dog to the therapy robot, although they spent more time with the therapy robot. So we wonder whether that could be about the novelty of the robot. They're kind of investigating it. It was a preference for therapy dog for all the age groups apart from the youngest children, when their preference was split between therapy dog and basic wag and walk toy dog, which was interesting. So maybe we'll just take wag and walk toy dogs in for the little ones. So another study I want to talk about briefly is one that's just come out by Mueller and colleagues, which found that it was really, really robust, well-controlled study, and it did baseline measurements of students' anxieties and then compared and did a matched pairs design. So they found so they matched like high anxiety students together, then lower together, and they made them do a social stress test. So speaking in front of a load of people, as we are doing here now. And they either let the students, interact with a therapy dog, be in the same room as a therapy dog but not touch it, or just be in a room, I can't remember if they're interacting, but with a toy dog. And they found there was no difference between conditions. And that's quite interesting because this kind of goes in the face of loads and loads of past research that found that therapy dogs are more effective in reducing anxiety than comparison conditions. So this finding of no difference is really important because there is a bias in science that we want to show a difference, we want to show an effect. So the publication of this showing no effect is really interesting. My next steps in my research was to be taking what I found so far back into schools and hospitals, but obviously COVID. So I'm going to be doing a survey about therapy dogs, and it is open to pretty much everyone. If you own or have handled a therapy dog, if you work in a place a therapy dog's visited, if you haven't ever come across a therapy dog, if you're a child who has or hasn't come across a therapy dog, if you're a parent. So loads and loads of different types of people we would like to get responses of. So if you are interested in that, I'm going to speak to Ruby and see if I can get permission to try and share that. But if you'd be interested in filling that out, just drop a little note in the comments and I will send you a link to that once it's published. But other than that, that is everything I had to talk at you about today. So I'm going to go through the comments, and if anyone had any questions or has any questions, please feel free to post them. So yeah, who's got a client who wants to do therapy dog work. So the reason why I found the organisation that I'm involved with was the suggestion of my puppy school tutor, Louise. And she said, "Oh, have you heard of them?" And I was like, "No, but I will look into them." And so there are, from my understanding, there are two main therapy dog organisations in the UK, Pets of Therapy and Therapy Dogs Nationwide. And I think they're pretty much the big two, although there are other ones. And from my experience, and this could be completely wrong, Pets of Therapy seem to have really good links to the NHS. So if that's the kind of visits that they're looking to get involved with, then that might be a good one to go for. Yeah, Alice and I agree. Just expect them to sleep in a busy classroom, especially I can imagine. So mine was, when I worked in a school, it was a secondary school, and particularly it was in the kind of special needs unit. And even just getting some of the great big year 11 boys to leave Tallulah alone was like, from a very loving. They wanted to smush her and stroke her, all that kind of thing. That was hard enough. So I can't imagine a young primary school students. That would be tricky, but yeah. Therapy Dogs Nationwide do go into NHS. So the therapy dog courses I know of. I mentioned Pets Therapy and TDN. They are organisations that kind of support you kind of once you've qualified with them, once you've done your assessment with them. So I mentioned at the beginning about a couple of instructors. Is literally two instructors who have messaged me privately when I was trying to recruit people for a study previously. Unfortunately, I don't know of any actual courses or any training, which is like part of the problem. Sarah's client's thinking more of schoolwork. The puppy's young, so it's no more than sort yet. Yeah, so like I said, as the puppy grows, you might get more of an idea about what it's suited for, and definitely download the assessment criteria, because I found that stuff like giving paw too much, or how they want the dog to react, so they drop a walking stick and see the dog's reaction to it. So stuff like that gives you a start of a indication about what you could train or look at personality-wise in your client's dog, sorry. Talk so much, my coffee's gone cold. Right, I think I'm going to end that there. But I'll keep monitoring the chat and reply to the comments in the chat very quickly. Oh, nice. Her dogs are Therapy Dogs Nationwide trained. Now she's running her own business, visiting schools. Just interesting formal training. Yeah, I think it would be really interesting to get something like that set up. There's a definite niche in the market for anyone who spotted it. I have expressed an interest in becoming an assessor for your organisation, but I have not heard back yet. Sarah, I will send you the link for the assessment after I've finished. So thank you so much. I think I've sparked a light bulb in Alison, who is now going to go set up her own therapy dog training academy. I hope you enjoyed my talk. Thank you so much for attending, everyone. Speak soon. Bye-bye.